Now, hepatitis B and C are two of the viruses which infect the liver of a patient. The other viruses like A, D, E, etc. are also there. But B and C are important because they can cause chronic liver disease. The other viruses cause acute liver disease, which is a self-limiting disease. So the patient recovers completely. While in B and C, the chronic liver disease, the virus remains in the liver for years together and can lead to chronic liver disease, cirrhosis, and ultimately liver failure, and in a few cases even liver cancer. Hepatitis B and C is spread mainly through blood and body fluids. So that means any person who is getting blood transfusions, and if the blood transfusion is not from a reputed blood bank where they have not checked carefully for hepatitis B and C, can be dangerous. The other thing is, if the patient receives injections etc. with infected needles, even then in that case a patient can get infected. Then injectable drug users or drug addicts who share needles and syringes, they can also spread infection from one to the other. These modes of transfer are there common for both B and C. But in B, the other two important modes of transfer from one person to the other are, one is mother to child. That means when a pregnant mother gives birth to a child, she can transmit the virus either during the pregnancy or during the delivery. And secondly, sexual transmission. That means during sexual intercourse, the virus can be transferred from one person to the other. Both these, that is mother to child as well as sexual transmission, are present for C virus also, but to a very, very small extent. Why is it important to treat hepatitis B and C? As I've already mentioned, that because it can give rise to serious disease which can be life-threatening to the patient. And what happens is that if you do not detect it early and if it remains in the body for a long period of time, it can cause irreversible damage which cannot be treatable except with a liver transplant or something like that. So that is why it is important to know about hepatitis B and C, so that we can do prevention for hepatitis B and C. Who can get hepatitis B and C? Basically, any person who is exposed to the virus. For example, as I mentioned earlier, if you have been exposed to injectable drugs like drug addicts, or if you are exposed to an injection which is given with an unclean needle or a non-sterilized needle. Normally nowadays all of us use disposable needles for treating patients, but sometimes it will be possible that in certain remote areas these injection needles are used, so they can transmit infection from one patient to the other. Then the sexual partners of infected patients are at risk for developing infection. Drug addicts are at risk for developing infection. Then children of mothers who have the infection are also at risk. So it is important that all the mothers are screened, especially for hepatitis B, because as I said, it is more important in the spread of hepatitis B, and the spread can be preventable by taking various measures like vaccine and certain injections, etc. The other high-risk individuals for hepatitis B and C are healthcare workers, which includes us doctors, then paramedical personnel like nurses, etc. and hemodialysis patients also, because again it is a infection which is transmitted through blood. To detect hepatitis B and C, we only have a simple blood test. Normally patients do not have any symptoms for quite a few years once they develop the infection. The first, say 10 to 15 years, the patient will be completely asymptomatic. It is only when the liver damage continues further that the other symptoms come up. And the symptoms which come up are generally swelling of the feet. The patient could develop jaundice. Sometimes they develop blood vomiting and black colored stools because of internal bleeding. And in the later stages, they can develop coma or even kidney failure. But as I mentioned earlier, majority of the patients do not have any symptoms. So it is important that we know this fact so that we can detect it at an earlier stage when it is very, very treatable. And the only way to detect it is by doing routine blood checkups, and these include liver function tests like bilirubin, SGOT, SGPT, and tests for hepatitis B and C, which includes HBsAg and anti-HCV. So if these are detected early, you treat the patient early and you save the life of the patient. We can definitely prevent hepatitis B and C by taking few simple precautions. One thing is that, as I mentioned earlier, your blood transfusions should always be from a reputed blood bank. Whenever you are receiving injections, you should see that disposable needle and syringes are used. A mother should always be checked for hepatitis B to see that she doesn't transmit the infection to the child. Then safe sex should always be practiced. Then intravenous drug abuse, etc. should be definitely avoided. So these are some of the methods by which you can avoid hepatitis B and C. Of course, there is another way in which you can prevent hepatitis B, and that is the use of vaccine. We have a vaccine for hepatitis B, though unfortunately as of now we do not have a vaccine for hepatitis C. It is important to know that hepatitis B vaccine has 3 doses. So you should always see that you complete all the 3 doses, otherwise you will be incompletely protected. Hepatitis B and C definitely can be cured with the use of drugs, especially if it is detected earlier. Especially hepatitis C, with the newer drugs coming up, hepatitis C can be cured in almost 90% of patients, and the patient can become free of the virus as well as free of the symptoms, and the liver can to a certain extent come back to normal. Hepatitis B also has certain drugs and injections available for its treatment, but unfortunately as of now hepatitis B treatment is incomplete, in the sense it does not completely clear out the virus. As there are advances in the medical fields, hopefully this will also come through. So it is important that we prevent hepatitis B, so that, because the treatment is very difficult. Once you have developed hepatitis B and C, you have to see to it that you do not cause any more damage to the liver. So it is important, one, that alcohol should be totally abstained from, that means no alcohol at all. Secondly, you should watch your weight, in the sense fatty liver, which is another important cause of liver damage, should not be a contributing factor to your liver disease. So you have to maintain your weight to the ideal body weight. So in this manner you will prevent further damage due to other causes. Now, precautions to be taken by a hepatitis B and a hepatitis C infected person. If the patient has any wound, you should see to it that the wound is always covered and the wound is not exposed to any other person. any blood spills of a hepatitis B person should always be cleaned with bleach so that it kills the virus and it does not spread. Normal day-to-day functioning for both hepatitis B and C is allowed. In hepatitis B, all the contacts of the patient should be necessarily vaccinated, especially the spouse, because of the risk of sexual transmission. And if they are not vaccinated, then of course condoms etc. should be used to prevent further transmission. But separation of utensils etc. is definitely not required, and you can hug a person, you can kiss a person, you will not spread hepatitis B and C. So on this occasion of World Hepatitis Day, I would like to reiterate the fact that both hepatitis B and C are preventable. You should try and see that you detect the disease early, and so that you do not develop the problem of chronic liver disease.